video, we are going to be talking about the checkout process and clearing up some questions between the FC and DA different roles. The first checkout process that we're going to be talking about is when your patient does not have any future treatment needs or there is no balance on the account. The DA is going to be responsible for walking the patient out to get their toothbrush and prize and reminding them that we will be seeing them in 6 months. For our second one, it will be if there is an estimated balance on the account, but there's still no future treatment needs. The DA will say hello to our FC for the day, introduce mom to the FC, and drop her off to pay the balance while they take the patient to get a toothbrush and a prize. By that time, the checkout should be complete and the DA can show mom and the patient out the door. Again, reminding them that we'll be seeing them in 6 months. When it comes to future treatment needed for the patient that you've been seeing for the day, but there is no balance on the account, we are going to start off with radioing to our FC the patient's name and the type of treatment that we are going to be bringing them up to schedule so that the FC has time to prepare the proper paperwork. You, as the assistant, need to double check that there is no balance on the account. You will talk to the parent and let them know that we are going to be scheduling that future treatment in the front with our FC for the day. FC's names and receptionist names are located in sterile on your position sheet for the day. At that point, you will be taking your patient to the consult room. Please remember to let your FC know, again, the patient's name and type of treatment needed while you're at the FC desk, just to make sure that the handoff is smooth. At this point, the FC will walk in, take over, and assist with scheduling that appointment, as well as taking the patient to get a toothbrush and prize and walking them out. This is going to be our last example of the checkout process for DAs and FCs. This scenario is going to be when there is treatment needed and a balance on the account. You, as a primary DA, should let the FC know the patient's name and the type of future treatment that is needed so she can prepare for scheduling this patient. You will walk the parent to the FC counter. The children are allowed to sit in the FC room while we help check out this family. The FC will locate the patient's name, check them out, and then instruct them to walk over to the consult room. As the DA, you will say goodbye, remind them that we will be seeing them in 6 months for their next cleaning, and that the FC will take over from there. This is when the FC, again, will check out the patient, schedule future treatment needed, and be responsible for walking the patient to get a toothbrush and a prize. Dental assistants and financial coordinators, give yourself a pat on the back and hand it over to your managers for this last part. If we are needing a RAD appointment, a referral to oral surgery, or a special GA visit, which involves a GRMC, this is going to be where the managers are radioed to whatever chair you're at. You'll let them know the patient's name and what kind of treatment they're going to be needing. The manager will come over, most likely take your patient and parent from you, and finish everything that they are going to be needing, whether it's a balance, scheduling, everything on the account they will be aware of and will be taken care of as well. They will also be taking the patient to get a toothbrush and a prize and walking them out, and we thank them for that. To conclude this video, I do just want to touch on a couple of extra points. First and foremost, as a dental assistant, you do not need to know anything about insurance. It is not important. The only thing that you want to focus on is if there is a balance on the account. Second, there sadly is only one prize per patient seen. So we might have some tears from some other family members when they see all the prizes that we offer, but that's an incentive for them to come back and see us. Third, for the family groups, just make sure as dental assistants we communicate with each other, letting each other know if there is a family assistant that's left with all the patients at the very end. if our personal patient has any treatment needs, if we see balances, just communicating all across the board with family groups. And last but not least, when the FC is busy, yell at her. Just kidding. Make sure that we are radioing for the manager to come and help out, because of course our FCs do get very busy. And if we have a manager that's busy with the family as well as an FC that's busy with the family, hang out, spend a couple extra minutes with your patient and their families, make things a little bit more fun for them, just so that we are not losing them in the chaos in our office, as well as letting them know how important they are to us. And again, just spending those extra few minutes with them. So thank you guys, and I hope all of your questions have been answered and cleared up.